Hi everyone, I'm Tanya Matthews. I'm a registered nurse, and my job is to coordinate an education program for practicing registered nurses who want to enter critical care emergency nursing. I also work at the bedside at the Queen Elizabeth Hospital as an ICU nurse for just over 12 years now. I've had a happy career, and nursing is a very exciting profession. The education program that I coordinate originated back in 2009. It was part of the Research to Action project, which was a national project across Canada that was designed to recruit and retain nurses in each province. So PEI identified an education gap for the specialty training of critical care and emergency nurses. And what we did was collaborate with a number of different partners in order to make this project possible in a small province, but also affordable. One of the main partners in the program is the Registered Nursing Professional Development Centre in Nova Scotia. So we broker their program. They already had a well-established critical care and emergency nursing program, so we didn't reinvent the wheel, we borrowed their curriculum. And that's nice because it standardizes education among nurses in Nova Scotia as well as all the nurses here in Prince Edward Island. Prior to 2009, each facility on PEI was doing something different, and now we have a standardized approach to education. The ultimate goal, of course, is to deliver better care at the bedside for patients across Prince Edward Island. Other key partners in the program include the University of Prince Edward Island and, of course, Health PEI. So the University of Prince Edward Island supports this program by providing me with office space, but more importantly, provides the learners with access to their learning resource lab, where we do skills as well as simulations with the learners. Health PEI is the main funder of the program, and they have been very supportive in partnering with Nova Scotia to make sure that this program can continue. Another key partner is the Prince Edward Island Nurses Union, PEINU. Mona O'Shea sits on the steering committee for the project, and they also offer an education fund to the learners so that they get help with their tuition and their books. And Mona is always a great advocate for the learners around the table. ARN PEI also supports the program. They've offered letters of support in the past with past proposals for the program. And our education, the continuing competency of registered nurses, sits very well with the ARN PEI mission to promote the standards of nursing in the nursing profession. ARN PEI also has a member who sits on our steering committee as well. So lots of nursing leaders from across PEI are part of the steering committee, and we're all committed to providing specialty education to the nurses of Prince Edward Island so that that translates into better care at the bedside. As I mentioned, this program has been running since 2009, so we're now on our 8th class. So that translates into about 80 plus nurses across PEI now trained in their specialty. And that's really improved the numbers, the percentage of people in the ERs and the critical care areas across Prince Edward Island who are trained in their specialty, either through CNA certification or CCEMP certification. So for example, in the Prince County Hospital, in their ER, over the past few years, they've increased the percentage of specialty trained nurses in that field from 19% to 44%, so that's a significant increase. And what that means now is there's nurses in the system who are now excellent preceptors and mentors for new graduates and new employees entering these areas as well. And then it really has a large impact on the rural hospitals as well. So for example, Western Hospital now has over 50% of their nurses specialty trained. So this is significant. What the students learn is evidence-based practice, and so what they know the why behind what they're doing, and they're better able to assess and anticipate and detect complications in patients, which translates into better patient outcomes. If a registered nurse is interested in this program, by all means apply. We have a limited number of seats right now. We have 10 seats per year, and that's split between the emergency nurses as well as the critical care nurses. The course is very multidimensional, so there is an online study portion to it, so you do theory through online modules, but there's also, it's a competency-based program, so at the end of the day the nurses need to perform the skills and apply the knowledge that they've learned. So there's also a lab simulation component to it, as well as a clinical practicum. We take students every January, and the course is 11 months in duration, so you will be working and studying on the side. So it's a part-time program, but it does require a lot of dedication and hard work, but the payoff is amazing. I have the privilege of watching learners transform. They come to me, they're great nurses to begin with, but they're exceptional nurses by the end of the program, and it really is inspiring to see the development. And it doesn't matter if you're a new graduate, it doesn't matter if you're an extremely senior registered nurse, everyone benefits from the program. So the ultimate goal of the program is to develop nursing competency through education so that we can build well-trained nurses who can then go on to foster the next generation of nurses and new graduates, with the ultimate goal of delivering the best possible patient care at the bedside and for excellence in nursing.